And there are promising signs tonight in Boulder make that Colorado's battle against the latest COVID surge.
Cases appear to be leveling off. The latest data from the state shows more than 900 new cases. That's been trending down for the last 2 weeks now. The number of people hospitalized also stabilizing. There are currently 884 people being treated. Most of them are unvaccinated. Alan Janae working the story for us tonight and looking into this recent trend. Alan, the question now is what the weeks and months ahead will bring.
Big question, Karen. Of course, we've been here before. We reach a plateau, we start coming down, we think we're coming out of it, then we're back up again. There is a big difference, though, right now. Over 3/4 of Colorado's population, 76%, have now had at least one vaccination. But figuring out where we go from here is a complicated calculation. At a COVID testing site in Denver, the cars line up.
We had a friend whose daughter was exposed. We had dinner with her afterwards, and she told us about that.
So Dale Schellinger and his wife Fran came in to get tested.
I don't think anybody wants to be where we are right now in terms of, having 900 people in the hospital.
Dr. Elizabeth Carlton is with the Colorado School of Public Health at CU Anschutz, where they model a picture of where we are and where we might be going. In the up and down of COVID cases over the past year and a half, we reached a peak in November of last year. Our latest surge started to level off in mid-September.
I think the way to think about it is we're on a high plateau and hopefully starting to slowly wind our way down.
That's in spite of the fact that we're far more open than last year.
There are probably still more high-risk interactions happening now than any time in the pandemic.
If children get vaccinated too, it will help, she says.
We're in this somewhat uncertain position in that there's a few things pulling us in different directions.
Last November's peak, though, came when people moved indoors.
On the other hand, winter and the fact, that quite frankly, there is a subset of our population that's not getting vaccinated can pull us to an increase.
Now, a consortium of experts who advise the CDC and do their modeling also see a big decline coming. They set up a number of different scenarios, including a best-case scenario in which vaccines are approved for children and there's no development of some new insidious variant, to a worst-case scenario in which children could not be vaccinated and a new variant does come out. But the first scenario is, they believe, the most likely. And if so, they see a decline in COVID cases coming if children get vaccinated to a point where we have 1/15 the number of cases next March as we have today. In Denver, I'm Alan Janae, covering Colorado First.